think we're good to go. Thanks again, everybody, for joining us today. This is the second day of National Arthritis Week, and we are hosting a webinar with Professor Helen French from the RCSI. The title of the webinar is Physical Activity, Exercise and Arthritis, and we are going to be busting some common myths. Just a little bit about National Arthritis Week. This week, our theme is myth busting, and each day we are addressing 5 prevalent misconceptions associated with arthritis. And the objective of this week is to raise awareness of arthritis and also to empower individuals with the knowledge and skills to better manage their condition. We're also running an additional webinar on Thursday this week, which is Arthritis and Food, Everything You Need to Know, with registered dietitian Louise Reynolds, who is also communications manager at the INDI. If you want to register for that webinar, you still can at arthritisireland.ie. We also had a webinar yesterday with Dr. John Stack, consultant rheumatologist, and he was busting the myth that arthritis is just an older person's disease. So that will be available to view on our YouTube channel shortly, and if you would like, you can watch that back. So as I said, Professor Helen French is joining us today. Professor Helen French is a chartered physiotherapist and associate professor in physiotherapy at the Royal College of Surgeons in Ireland. Helen previously worked as a musculoskeletal specialist in a teaching hospital before moving to the RCSI as a lecturer in 2004. She completed her PhD in 2011, which involved a clinical trial evaluating the effectiveness of exercise and manual therapy for hip osteoarthritis. Helen's research interests also include the physiotherapy management of musculoskeletal conditions and the role of exercise and non-pharmacological management of osteoarthritis. So our webinar today will discuss strategies for incorporating physical activity into everyday life and the types of exercise that are suitable for those who are living with arthritis. Just wanted to mention a little bit about Arthritis Ireland. So we are the national charity and patient organisation for people living with arthritis. We deliver support, training, education and information. If you have a look at our website, you'll see we have a wide range of videos, podcasts, blogs, information about specific to different diseases, arthritis types. We also run a lot of self-management programs, which are there to help people on their journey with arthritis. And our free national helpline is also open from Monday to Friday, 10 to 4 for support, information, or if you want to register for any of the programs. Our helpline number is 0818 252 846. And if you are in any way struggling with your arthritis, if you want information or support, please do ring the number. We have people who man the helpline are those who live with arthritis themselves or who care for somebody with arthritis. And again, our website is arthritisireland.ie. Just a thank you very much to our sponsors, AbbVie and Novartis, who are supporting us this week in all our activities, and without them it wouldn't be possible. We also rely on the generosity of the public to ensure that we can continue to provide our essential services and supports to everybody living with arthritis in Ireland. And there are lots of ways that you can support Arthritis Ireland this week. You can make a once-off or a monthly donation, and you can scan the QR code on the page there or visit our website. And additionally, we are also hoping to encourage people to sign up for the VHI Women's Mini Marathon and to raise funds for Arthritis Ireland during what is a very fun-filled day. So we hope you'll join us on the day. Just a couple of things about housekeeping. Everybody but the presenters and speakers are on mute and your cameras are off. We will have 30 minutes for Q&A at the end, and Helen will take as many questions as she can. If you do have a question, put it in the Q&A function in Zoom, and you can do that throughout the webinar itself, and we'll do our best to respond to as many as possible. The webinar itself then will also be recorded, and it'll be available to view on our YouTube channel from tomorrow. So thank you very much. Without further ado, I'm going to hand you over into the very safe hands of Professor Helen French, and just a reminder there of our website and helpline number if anybody needs it. Thank you, Helen. Thank you for being with us today.
Thank you very much, Cara. I'm delighted to be here, and I'm delighted to talk on this topic. I'm going to just share my screen. So hopefully you can see the screen moving there. So yeah, so the title of this talk really is trying to debunk some of the common myths around exercise and physical activity in arthritis. So what I'm going to talk about is, first of all, just defining what we mean by physical activity and exercise, because sometimes people kind of separate them out. Sometimes they're kind of put together. So what do they actually mean? And also just to run through guidelines about what is recommended for people from cradle to grave, from childhood right up to adulthood. And then just to give a nod to the different types of arthritis, because this is really about different types of arthritis. I will also then try to cover some of the more common myths that people have, and then finishing with some top tips for staying active with arthritis. So hopefully you can see my screen advancing there as I go on. So Tara has probably already done this for me. So thank you, Tara. Just to explain that I am a physiotherapist by background, and my research is most focused on osteoarthritis, but I do I've obviously managed people with other types of arthritis when I worked in a clinical role in a hospital setting, and I teach our undergraduate physiotherapy students about all types of arthritis and musculoskeletal conditions. And currently I'm the principal investigator on a project called ENACT, and this is really trying to improve the management of osteoarthritis in primary care, so out in the community, really outside of the hospital setting in Ireland. So I think the first thing to do is really just clarify what we're talking about. And as many of you know, we have lots of different types of arthritis, or lots of conditions that come under this umbrella term of arthritis. And I suppose in this presentation, I can't go into every one specifically, but I do recognize there are lots of different types. Some are more common than others. The most common is osteoarthritis, which is a degenerative arthritis. And then I suppose the next most common are conditions like rheumatoid arthritis and ankylosing spondylitis. And these are inflammatory types of arthritis, and they are quite different in terms of the pathology and in terms of how they present. And I suspect that Dr. John Stack covered that yesterday. And then we have other conditions that aren't really arthritis as such, but they're pain conditions like fibromyalgia. But the principles are the same. And, you know, I suppose I'll try to cover them as we go through the presentation. So I'm going to start, first of all, by what is physical activity. And this is the definition that's used really worldwide. So it's bodily movement produced by skeletal muscles. And what we mean by skeletal muscles are basically the muscles all around our body, as opposed to our heart muscles. And it's where we require energy expenditure. So we're burning calories to do that activity. And it can range from virtually nothing happening when we're asleep, right through to vigorous. And you can see there, as you go from left to right, we can go from sleep to sedentary. So sedentary is just literally sitting, not moving. And you can see for each one of those, there's a number assigned, which are what we call metabolic units, and they're related to that energy expenditure. So as we go from left to right, obviously we're increasing our energy expenditure and increasing our calorie consumption. So sedentary would be sitting, light could be, you know, kind of slow paced walking, moderate can be quicker paced walking, faster paced walking, for example. And then vigorous is, for example, running. And we've lots of examples through things we do every day, and I'll allude to them as we keep going. So I think the thing about physical activity is that it's things that we do all the time. We probably don't realize we're being physically active. We're burning calories, we're expending energy, and we're engaging in bodily movement. So it could be the housework, sweeping the floor, hoovering the floor, you know, walking around the shops with the trolley, and then even if you're carrying shopping bags kind of around for distances, you know, think about going out into a shopping center for a few hours, you know, how much energy you're probably consuming there. You're at the airport and you've got the stairs there and the escalator. And what's interesting in this picture is there's one lonely figure taking the stairs and everyone else is taking the escalator. But, you know, that person on the stairs is going to expend energy and engage in physical activity. Then we have things coming into the summer now. People are starting to think about the gardens. So we have the gardening, the mowing the lawn, you know, literally the tending to the flower beds. That's all physical activity. And then it could be other things that you do because you enjoy them. So again, we're coming into the summer. People start to think about getting into the sea when it starts to warm up a bit and, you know, you're moving around in the sea, and that could be kind of at a slower pace, or it could be a bit more energetic. Now, there's lots and lots more examples of that. And, again, I suppose we kind of always revert back to why would we be physically active? And outside of helping arthritis, it has numerous health benefits. And just as probably just a nice kind of summary catch-all slide here that shows all the health benefits of being physically active. And we often hear this term, kind of exercise is medicine or movement is medicine. And it can help across lots of our body systems. So it can help our brain health and reduce risk of dementia. It can help our bone density and our strength, for example, then reducing the risk of hip fracture, particularly in older people. If they engage in physical activity, it can help our mental health, and so therefore reduce depression. It can, moving around the clock, so to speak, if we're down at the 6 o'clock there, you can see it reduces the risk of certain types of cancers, particularly breast cancer and colon cancer. It reduces risk of type 2 diabetes, heart disease, so cardiovascular disease, so things like stroke and heart disease and heart attacks. And then up at the very top, at that kind of 1 o'clock part of the circle, you can see there's also this all-cause mortality. So that means that it reduces risk of death from any cause. And some of these conditions, I suppose, are life-threatening. Not all, but some are. So lots of reasons to be physically active. And we have a lot of physical activity guidelines, and I just want to give a nod to those. Some of them I'm going to make reference to in this presentation. So most recently, we've had the launch of the Irish specific physical activity guidelines, Every Movement Counts, and these were developed by Healthy Ireland. Then we have the 2019 UK physical activity guidelines. I have some reference to those as well in the presentation. And then we have the World Health Organization physical activity guidelines, and they also kind of talk about this sedentary behavior. And really, they're all saying the same thing. They might be slightly different in the way they word it, but effectively it's the same information. And so I'll start with this one, which I think is a really nice kind of a summary slide of physical activity from the World Health Organization guidelines. So going from left to right. So if you look on the far left, you can see there that big X about limiting our sedentary time, and that's our sitting time. And I'll come back to that in more detail. And we should be replacing it then with some physical activity. And I think the third one is probably the most important, because people sometimes think, oh, I have to do X amount of minutes a week, but actually anything is better than nothing. So, if you're sitting there thinking, oh, they're telling me to do 150 minutes a week, I can't do that. It doesn't matter. Doing anything is better than doing absolutely nothing. So the guidelines at the moment can vary depending on the population, whether it be adults or children. And you can see that down on the bottom there. But, we do still have that 150 minutes a week or 30 minutes, 5 days a week for adults, and then 60 minutes a day, so 7 days a week for children. And that would really be for the adults, is really right through from 18 right up to kind of older age. But also we have recommendations to strengthen muscles at least 2 days a week. And then for older adults, and again, I'll touch on all of this in a bit more detail, but for older adults then doing multi-component activities for balance and strength at least 3 days a week. And that's really trying to reduce risk of falls, and also just to protect against frailty, which we know happens in older age. And so multi-component activities could be things like Tai Chi, for example, yoga, and so on. And then I suppose really there is a dose response. So in other words, the more you do, the better. So for some people, getting to the 150 minutes might be a difficulty, might be a struggle, and that's fine. For those who are getting to the 150 and they can go beyond it, brilliant. More is better for anyone who can do that to see those health benefits. And this, I really probably says the same thing again, but again, it's a nice kind of a picture that probably simplifies it if you were to kind of take one message away and one visual away. And this again is the 150 minutes. I suppose what differs a little bit in this guideline from the UK is it really just talks about the intensity. So 150 minutes a week or 30 minutes 5 times a week of moderate intensity. So what do we mean by moderate intensity? Well, it's really the kind of, you still can talk. So you know your heart rate's up, your breathing is a little bit more labored, but you can still talk. And this could be through a brisk walk, swimming, cycling, but you know, there's a bit more than just a kind of a stroll around the supermarket. Or you could replace that with 75 minutes of vigorous intensity. So less duration, but just higher intensity. And this could be just your heart rate and breathing is more labored. It's a bit tougher to talk. And examples of this could be, you know, going upstairs, you know, again, at pace without stopping, running, and I suppose a lot of sports would come in under this. And we can see then the other elements there around the strength and around that minimizing sitting time. So we've talked there a little bit about the physical activity intensity. And again, this is quite nice from the UK guidelines, because I think it just simplifies when we talk about terms like light, moderate, vigorous. So the sedentary I've already mentioned is that sitting. And, you know, a lot of people listening may be, you know, in office type of jobs, that they may be sitting at desks. Some people may now be working more at home than they were 4 or 5 years ago, and therefore not even moving or commuting to work or walking around the office. So perhaps sitting has increased for them. People sitting watching TV for hours, and I think our lives now are becoming more automated. Technology is kind of almost creating this sedentary pattern for a lot of people. So we do have to actively try and switch that behaviour, I think. And then you can go on to light. So light could be some of that kind of housework, cleaning, putting out the rubbish, yoga. Moderate, as I mentioned, could be that walking at a fairly brisk pace, cycling, you know, doing the shopping because you're carrying maybe carrying bags, heavy bags that would probably increase your heart rate. And then vigorous things like dancing, swimming, playing sports, and then very, very vigorous, which is probably going to be a very small minority of people where you're doing kind of full-on efforts, and that would be your anaerobic type of activities like sprinting, you know, heavy weights, press-ups. And as you progress through those, what happens is our heart rate increases, our breathing rate, our respiratory rate increases, and our energy consumption increases. So I suppose that might be good guidance when we talk about this light, moderate, vigorous activity in the guidelines. So as well as thinking about being more active, we've got to think about sitting less and moving more. And that's just a good little term to think of. Sit less, move more. Again, there's lots of information out there that shows how long the average person sits, the kind of sedentary person sits, and that's 12 hours a day. And that's really far too much. So I suppose there's, again, a lot of websites out there. There's a lot of ways of tracking or trying to figure out how much you sit during the day, because a lot of people may not be aware of how much they sit. And there's also a few things just to think about in relation to sitting. And I'm a little bit guilty of the first one. So the common misconception that exercise can compensate for too much sitting. So you might say, oh, well, look, I do a lot of movement. I do my 150, 200 minutes a week. So it doesn't matter if I sit around the rest of the time. Well, actually, it does, because it doesn't compensate for too much sitting. The risks associated with too much sitting are very similar to the risks I've highlighted, or the, you know, around our heart health and brain health and so on. So we do need to kind of proactively think about sitting less. And therefore we have to replace sitting. So what do we replace sitting with? You know, we can't be kind of exercising and on the move all the time, but, you know, where are there opportunities for standing and walking? And I suppose a good example of this would be people at work, again, where people are sitting at a desk for long periods. It's about getting up and moving regularly. Some people now, you know, are using standing desks where you can stand at your desk for periods of time. And it's really to recognize that you might consider you're not doing very much by just standing and getting up and walking around a little bit, but actually they're more important than you think. And ideally then you want to alternate between sitting and standing for all of those optimal health benefits. And that's really even kind of talking outside of arthritis. So again, what would that look like if you were sitting watching TV? You know, you're going to be there for 2 or 3 hours. It's about making a conscious effort to get up. Unfortunately, some of the streaming programs now make it harder for us because there's no ad breaks and they jump straight into the next episode, and none of that helps us. So we have to make conscious efforts to get up, to stop it, to get up and move, to go and get, you know, a drink of something, go to the bathroom, and so on. Same on a flight or on a train, you know, you can just be sitting there for hours. People are coming to you, giving you things, and you have to kind of, you know, not encouraged to get up and move. So, you know, it's about, you know, making that conscious effort to get up and walk around the cabin on a flight. And again, if you're in work, it's about making a conscious effort every so often, you know, even in every hour, getting up 5 or 10 minutes and just moving around, stretching the legs. And for people with arthritis, I'm sure many of you there just realize sitting is not good for long periods. You know, obviously it's good to sit and kind of rest for periods, short periods, but sitting for long periods and not moving is not good for our joints, for our musculoskeletal health. They get stiff. We all know kind of what it's like first thing in the morning for people with arthritis, and that's again that not moving overnight in bed. Joints are very, very stiff. Takes a while to get going, and it's the same for sitting for prolonged periods. So there's lots of reasons to think about sitting less and moving more, and that moving more could just be a little stretch, stand up stretch, a little movement around for a few minutes, but just to break up that sitting time. So this is a really useful website, juststand.org. They've lots of really kind of simple information, practical information, but they've also got lots of research behind these theories. So then to move on to exercise, because I think, you know, people say, well, what's the difference between them and physical activity? I suppose exercise is just a subcategory of physical activity. Really, it's probably more structured, planned, repetitive. People would say, I'm going to exercise because they want to improve their fitness, they want to improve their health, they want to improve their strength. So they may go and sign up to do some kind of exercise for a particular purpose. So it's I suppose more planned, whereas physical activity may not always be planned. It can just happen just because of our lives. The problem is that people can take up an exercise program. They can sign up and do classes in a gym, or they can decide they're going to go and do a course of particular exercise, or they can go and get, you know, exercise from a health professional. But maybe when that stops, the physical activity may not be maintained. And that's our biggest challenge really, is to maintain the physical activity, the daily kind of incidental physical activity once structured exercise stops. So what types of exercise are there? There are loads of ways of classifying it, but I think this is probably the kind of easiest and fits in nicely with the physical activity guidelines. So we have aerobic exercise. So aerobic exercise is really our cardiovascular, in other words, our heart and lung exercise, which has all those health benefits. And again, lots and lots of examples: walking, cycling, swimming, aqua aerobics, dance, you know, anything where there's energy expenditure. Then we have the muscle strengthening. And if you remember, the guidelines recommended 2 days a week for strengthening. Again, sometimes people are a little bit put off by the notion of strengthening because they think they've got to go to a gym, they've got to lift weights, but there are lots of ways of doing strengthening. You know, using elastic bands like shown in the picture. You can use free weights like handheld weights, and even body weight. And I think one of the positives from COVID was the number of online resources that were developed and apps that really allowed people to do these types of things in their own home without having to leave their home. So these are all very possible to do with the right kind of mechanisms in place and the right advice in place. And then finally, we have that balance, flexibility. So yoga, Pilates can, you know, whilst it works on strength, it also can do a lot of around flexibility and combines them both very nicely. And then Tai Chi. And these have all been tested in research and shown to have benefits for people with arthritis. And I think I always just have that caveat with specific exercise that if you need a specific exercise program for your condition, it is best prescribed and supervised by a health professional, such as a physiotherapist, because then it can be tailored to your needs. And I use that word prescribed very deliberately because exercise is like a drug as such, you know, does have to be specific. It has to be tailored. It has to be dosed correctly, just like you dose drugs for conditions. And that, you know, there's a lot of specificity, I suppose, that goes into that when you go to get an exercise program from a health professional. So really they're just covering off some of the key principles and points. And now what I'd like to do is just go through some of these facts and myths. And I'm sure I haven't covered all of them, but just some of the more common ones that I would hear and patients would ask me about. And these are, again, just trying to cover most of the types of arthritis without getting into specifics. So I suppose the first myth is, well, I've arthritis, I shouldn't exercise. So exercise is bad for me. So I'm hoping by now that everybody knows actually exercise is recommended for arthritis. And for some types of arthritis, for example, osteoarthritis, it's actually the first line of treatment. So exercise is actually recommended before your painkillers and non-steroidals and so on. For other types of arthritis, we know that the drugs are hugely important for managing inflammatory arthritis, so the biologics and the disease-modifying drugs, and then exercise is used, you know, in conjunction with those. So the kind of where they sit in terms of, you know, kind of first-line treatments differs depending on the types of arthritis, but ultimately for all of these conditions, exercise is recommended. So why is it recommended? What does it do? Well, it does lots of things. And again, I'm kind of trying to cover them all in one slide, hopefully doing justice to it. So it reduces pain. We've seen that a lot in research. And again, most of the research really is probably on osteoarthritis, but, you know, it's as effective, or it's more effective than taking a paracetamol, that's for sure. And it can reduce disease activity in the inflammatory arthritis conditions. It can help with the everyday activities. So, you know, the simple things or the everyday things we do, going up and down stairs, getting out of chair, getting out of bed, you know, moving around the supermarket, driving, getting in and out of the car, all those things that we just probably take for granted until we have a problem, it can help with. So it can improve that everyday function. It can allow us to kind of walk safely. So in other words, we've kind of got that strength and support to be able to walk and also run. And I put that in very deliberately because people think, oh, I can't run, I've got arthritis, I can't run, I shouldn't run. And that's not always the case. Many people with arthritis can continue running and it doesn't do any harm. And then for all the other reasons I've mentioned already, it has this kind of whole body effect. And our joints have this structure called cartilage, which really is that like shock absorber of the joint. And actually the joint needs to be loaded. Most of our body systems need loading. Our muscles, our tendons, our joints, they need load, they need movement, they need exercise to keep the joint healthy. So if you don't move and you don't put load through them, you don't put weight through them, they don't thrive. And that's probably kind of counterintuitive for a lot of people who think you should be offloading the joint, taking pressure off the joint with arthritis. So the next myth then is, and this is probably just more specific to osteoarthritis, because we know that other arthritis have other reasons for presenting and lots of other risk factors, but this is certainly one I hear a lot. You know, am I going to get arthritis? I do a lot of exercise. Am I going to get arthritis? And really the answer is it's not. It actually can reduce your risk of getting arthritis. And studies have done this, and it comes back to what I've said a minute ago about joint loading, that our joints throughout our lifespan need to be loaded. You know, from childhood right through. So even what we're doing in childhood and adolescence and young adulthood has an impact what we do in later life when we get into middle age and older age. And we need to move joints, we need to load joints to actually stimulate the cartilage and stimulate the joints to get strong. So again, really, what does the joint specific benefits look like? So it keeps the cartilage healthy. It strengthens the muscles around the joint. And again, that's where specific strengthening can help, you know, really target specific muscles. And then it helps that mobility of the joint. And we know a lot of people with arthritis have a lot of stiffness and we need to keep that range of movement in the joints. And then, of course, we have all those other health benefits I've already mentioned that I don't really need to cover again, but just to remind you that you're getting a kind of a double whammy when you do exercise. Okay, so the next one then is really about, oh, well, I've got a flare up, and lots of different types of arthritis and these conditions have flare-ups. You know, things don't always go smoothly for people. People have setbacks, people have increase in pain, increase in fatigue, increase in swelling episodically. And then what do you do? How do you manage that? So I suppose the myth really that you should rest completely, it's not the case. And, you know, keeping some level of activity and exercise is good. So what would that look like? And I suppose the first thing to say really is that, you know, these are common. Pain flares are common across all of these conditions. Some people can't predict them, some people can, comes out of nowhere. And just to recognize that pain doesn't always mean damage. Sometimes people are afraid they're doing damage by continuing to exercise during a flare, but that's not the case. But what you can do is just put some changes or adaptations to your routine. So for example, you can reduce the duration or distance of an activity. So if you are in a habit of doing a particular walk or a particular exercise or a particular activity, just reduce the time you're doing it or the distance you're going for that period of time until it settles down. You might want to do exercises in sitting instead of standing. So lots of exercises can transfer quite nicely to sitting or lying down. Depending on the exercise, you might want to reduce the number of repetitions. So if you've been given a program and you're told to do X number of repetitions of that exercise, it's just about backing off that, cutting it down. And you're always better to cut down more rather than less. You know, if you're not sure, don't stop completely, but just tailor it back. And then if it feels okay, then you can start to progress back up again. And if you do have a flare that involves a lot of swelling, usually then icing is good for swollen joints rather than heat. So you might find ice around that area for about 15 minutes can help, and that might help before your exercise as well. So there are lots of things there that you can do to manage that. Okay, so the next myth is that exercise or activity should be pain-free. So in other words, I'm doing my exercise, I'm feeling pain. Again, that's that idea of doing damage. But pain and discomfort is common, and many people, I'm sure listening, have daily pain, and they know that their pain is there all the time. So it's then trying to manage how much pain can I allow, how far can I go, how much can I push it. And again, we just want to reiterate that pain doesn't always mean damage. But a traffic light system is useful to gauge how much physical activity or exercise to do. So we would use this a lot for people with musculoskeletal conditions. So you literally have a traffic light of kind of green, you know, orange and red, and it's based on a 0 to 10 pain scale. So a lot of you are probably familiar with being asked, usually by a physiotherapist, how would you rate your pain on a scale from 0 to 10, 0 being no pain, 10 being the worst pain you could imagine. So as you're doing that exercise, you're saying, well, look, it's okay, it's 2, that's fine. If it's between a 2 and 5, that's okay. That's kind of live with that, and you know, it's not going to set me back too much. But then if it's kind of anywhere between 5 to 10 and obviously closer to 10, then maybe then you just need to change the activity. It doesn't mean stop completely. It means maybe something needs to be changed. So that might be useful for people to gauge how much pain is acceptable. Okay, the next myth then is that, you know, well, there's no point unless I can do that 150 minutes a week. Why would I even bother? Because I can't even get to that. And I've already said anything is better than nothing. Okay, so this is a slide here which just shows the health benefits on this scale here. So they increase. So you can see this line increasing. This is our duration of activity over minutes per week. And we can see that obviously the more you do, there is a benefit in health, but it does kind of plateau off here. But what's most important is the person who starts at nothing here, and we see the greatest benefits actually in kind of up to that 100 minutes. This is where we see the greatest impact, and this just reinforces that message that anything is better than nothing. And because people who start from nothing and just increase their activity slightly will get those greatest benefits. Okay, the next one then, a lot of people, you know, we get these apps now that have this kind of step count, and people say, oh yeah, I have to hit my 10,000 steps a day. And again, it's actually that's kind of a bit of a myth, that where did that 10,000 steps a day come from? Is kind of not really kind of clear. So this is a useful slide here from research which looked at people, and I'm going to start with people over the age of 60. And the one here, it means nothing is happening, but anything below the line just shows you're getting health benefits, you're reducing your risk of disease that I've mentioned already. And the blue line is people over the age of 60. And then in the next slide, we cover people under the age of 60. But for the moment, for people over the age of 60, we can see here that something starts to happen at about 3,000 steps. We start to see a change in our benefit. And then, in fact, then we see a kind of a more dramatic benefit at 6,000 steps. So so that really kind of, obviously, as you keep going, you do get a benefit when you go up to 10,000 and beyond. But actually, even at 6,000 steps, you're starting to see a benefit for people over the age of 60. And 3,000 steps is equivalent to about 30 minutes, which again is what the guidelines recommend, 30 minutes, 5 days a week, 150 minutes. So, 3,000 to 6,000 steps, would still have a benefit. If we look at those over the age of 60, we just see you just needs to be a little bit more. So 5,000 steps, we start to see a benefit. And then we see that kind of shifting down. So this is the red line here. We can see this benefit here, probably peaking here, and then it plateaus off. And again, that's at about 8,000 steps. So neither of those are near 10,000. So, it's, as I said, that's just a number that we don't always have to be hitting. Okay, so I've covered most of those myths, and now to try and translate that into practical advice. So first of all, hopefully by listening to what I've said already, you're understanding that some activity is better than nothing. Doesn't matter what it is, it's something. Sit less, move more. Incorporate into everyday activities. So that's really switching away from this, I have to go to a gym, I have to join a structured class. There's lots of ways we can build it into our everyday lives. And again, I can give lots and lots of examples if that helps during the Q&A. But it's really just making that conscious effort to be less sedentary and to get up and move where we have an opportunity to move. For example, taking stairs instead of taking a lift, and I've already mentioned that. Choose something you enjoy, because there's no point in doing something if it's a chore every time. You have to enjoy it, you have to want to do it, you have to look forward to going out and doing it. Set short-term goals. A lot of people probably just set very long-term goals and unrealistic goals, and then they just seem completely kind of unattainable. And really it's switching also from that kind of I can't do it to I can do it. And by setting a short-term goal, it's going to be more manageable, and it can just be something in the next week, for example, I'm going to have done this. And that really relates then to a realistic activity schedule. And we would often use with patients this idea of SMART. So a SMART goal is a goal that's specific, it's measurable. So I'm going to walk X amount of time by this time next week, or I'm going to do X amount of repetitions of an exercise. It's achievable. It's relevant to your life and your work and your life and your family life. And then time bound mean that you're just setting it like in a week's time or 2 weeks' time. And so that idea of SMART can help. And certainly physiotherapists and other health professionals would use that in goal setting for patients in their exercise prescription. So use a fitness monitor or phone app. It can help. Some people are very motivated by their Fitbits. Their apps, there are lots of apps online, they're free, but they're just that nudge that you can have on your phone to do something. It might be a short, it might be reminders, it might be a series of exercises. There's one, for example, to do with standing, getting up and moving regularly to get you out of that sedentary position. And then I think finally, the kind of activity buddy or a group is just huge. All you need is one other person. You need one other person to say, okay, we'll do this, and then hopefully you both don't back out, and one of you at least will kind of say, we'll do it. Doesn't matter if it's raining, we're going to get out and we're going to do it, and we know we'll feel better afterwards. And I think that's the big thing, which I always say to myself half the time. I don't want to go out and do something, but I say, you know what, I'm going to feel so much better after this. And that's what kind of is the motivation. So, and there are lots of ways of kind of doing that in groups, and a lot of opportunities. Okay, now really, I really just have to mention Arthritis Ireland and the fantastic resources they have, and going onto their website and seeing what's there. And I'll just mention a couple. So the first one then is the Be Active with Arthritis programme. This is an exercise programme developed by Arthritis with the Irish Society of Chartered Physiotherapists. It's a 1-hour class directed by a chartered physio. Its details are on the website. There's an email. It does have to be pre-booked. It's a free programme, but really it is for people with all types of arthritis. So if you're not aware of that, please consider that. And the other thing is, sometimes people don't know where to start and just kind of need all these tools to kind of get them started and to be able to self-manage. And self-manage means that we're kind of giving people the power to be able to manage their own condition. It's a chronic condition, and how do you manage it? Kind of, you know, it's not realistic to always go and get treatment, active treatment and exercise programs. So this is the Arthritis Living Well with Arthritis program. It can be online or in person. It's a 6 weeks course, once a week for 2.5 hours, and it focuses on that, all these self-management principles, managing symptoms, learning skills and techniques to manage physical and emotional well-being, giving you the skills to be an active partner with your healthcare team, and also that planning for flare-ups that I've already mentioned in relation to physical activity. So it's a fantastic resource, that's there also for members, and it's delivered by people with arthritis, so they know exactly what people are going through who attend the course. Okay, so I tried to kind of leave with some take-home messages. So the first one is being physically active has lots of benefits, and of course for our joints it has, and for our musculoskeletal system, all those muscles and tendons and joints, it has considerable benefits, as well as the general health benefits. Exercise is just a structured form of the same with similar benefits, and we know that exercise can prevent osteoarthritis. We know that exercise is recommended for all types of arthritis and pain conditions. And these can produce specific effects on the joint, which is of course what people with arthritis want, but also you're also getting the general health benefits. Just remember, all physical activity counts. You don't have to hit a magic number. Something is better than nothing. If you have a flare, don't stop. If you're having a bad day, just your head's not in it, just don't stop. Just do something, because you will feel better afterwards. And then, as I said there, something is better than nothing. So there's lots of resources online from Arthritis Ireland. I just want to make reference to two things that were done recently that really probably say it's similar to this. First one is the Breaking the Pain Cycle webinar, which was done with my colleagues from in RCSI. That's on the YouTube channel. And then recently I did one of the podcasts in the Inflammation Nation podcast series. And this was specifically for osteoarthritis. And we just had a chat about the role of exercise as a first-line treatment. And they're available on Arthritis Ireland website also. Now, I just want to acknowledge people who I suppose have kind of provided some of the sources of information in these slides through various presentations we've done in the past. So I've already mentioned my colleagues Suzanne McDonough and Jenny Ashton in RCSI. And actually Suzanne is doing a research looking at how to maintain activity in arthritis, specifically after the Be Active with Arthritis program. So she's trying to see how people can keep that lifelong levels of physical activity, and that research is funded by the Health Research Board. And then I collaborate and have lots of connections with a group of researchers who really are trying to progress osteoarthritis care in Ireland through exercise. So we are just called PACE. And my colleagues here, Clodagh Toomey, Helen O'Leary, Joyce Cunningham, Michelle Hall, and Avantika Bardwat. And we are in different institutions in Ireland. And in fact, Michelle is in Sydney in Australia, but Irish. And we are all doing research in this area. And our research is funded by organisations such as the Health Research Board. And so all of these people have contributed some of the content to these presentations that I'm sharing today. So thanks very much, everyone, for listening. I'm really happy to take any questions.
Thank you very much, Helen. Really appreciate that. That was fantastic. We've lots of questions coming in, so please continue to put them into the Q&A if you would like to. So will I go to the first one, Helen? Is that okay?
Yeah, please
Great.
do, Tara.
So the first one I have severe degenerative OA, osteoarthritis in both knees. What exercises would you recommend for me? I'm not able to do basic yoga as it involves a lot of kneeling, which I'm not able to do.
Yeah, and I suppose I always caveat any of these with, it's very hard to give a kind of like what I said there about the specificity of exercise until someone has had a full assessment as such. But there are options. I mean, obviously hearing that you can't kneel, then maybe exercises can be done in sitting or lying down. There's certainly lots of movement exercises. Keeping the movement in the joints is really important. Keeping that full bend, keeping the full straightening of the joint, really important. People can do like, you know, kneeling puts a lot of probably pressure on the joints, but people can do exercises in standing without it being you know, really aggravating. I guess water is a really good medium to do exercises. So that's why people like swimming. People don't have to swim to get into water. People can do aqua aerobics. Even if you don't go to a structured aqua aerobics class, you can get into water and walk in water, and people do that. People walk in the pool. You may not have a pool nearby. So that may not be an option, but you know, you can still do exercises sitting. You can do exercises, as I said, lying down, where you can do, like, I suppose, Pilates type of exercise. Doesn't always involve a lot of kneeling. Yoga, I guess sometimes, depending on where you're going to look for some of these things can be modified. So it depends on where you're going to find these resources. And I just do want to give a mention to Healthy Ireland website. So it is an initiative of the government and of the HSE, but that is all about health and well-being. And when you go on that website and you can click on one particular, you know, Google it, and you can click on one particular section, which is physical activity. And actually in there are loads and loads of resources, and they have links to online videos of exercises for people. And so people might find some resources there for them. I guess for that person, you know, maybe getting to see a health professional like a physio to give you some of that tailored specific exercise might be an option. I'm not sure if it is, but that might be worth doing just to get you on a path to kind of show you, you know, kind of get the basics and just pick out a few key exercises that would help. Doesn't mean you have to go for a whole load of treatment as such. Sometimes 1 or 2 visits to a physiotherapist can kind of get you started.
Okay.
So that's some advice.
That's great. Thank you very much, Helen. We have another question here from someone who says they're very stiff when they start walking, even limping somewhat, but after a few minutes then they're okay and they keep going and they enjoy it. Should they warm up more before they start, perhaps?
Yeah, that's you know, that's a one that I think a lot of people, it'll resonate with a lot of people. It resonates with me. I can be stiff. If I've been sitting here for a couple of hours and I go going, I can be really stiff. So yes, you could do a few little kind of exercises, little stretches. I suppose usually then people are stiff and limping because it's probably the hips, the knees, the ankles, the feet. So again, you know, simple kind of knees to chest, even standing, kind of doing a little swing of the hip, kind of forward back, just making sure maybe you're holding on to something. So yeah, you could absolutely do a little kind of a warm up before you're walking. I mean, in a way, the kind of walking and the little stage of limping at the beginning, that's not unusual, that's not uncommon at all. I wouldn't worry about it, you know. It is literally just that those joints have been in one position. If you've been sitting for a while and they've been in one position and now you're just trying to get them into another position, and it kind of reinforces the whole sit less, move more. So if you find when you're going walking, maybe you were sitting at work for hours or in the car and then you're going walking and then you're feeling stiff, so it could be that you just do a little kind of walk around the house first, or it could be that you be more attentive to not sitting for as long in that period before walking. Or again, it could be first thing in the morning. A lot of people get up early in the morning and they walk, and it might be just that early morning stiffness that is very common. But certainly a little warm up is great. It's but I would, I guess, just reinforce that that's initial stiffness and limping, that is not uncommon at all. And it kind of reinforces my message, what that person said there, that when they get going, they enjoy it. And that's 100% what I love to hear.
Yeah, I mean, it is really about enjoyment and you know, getting the most out of it and making it part of your day, isn't it? So, yeah. Great. There's another question here about cycling, and is that safe for people with knee osteoarthritis?
Yeah, cycling is a really good option, because it does well, first of all, it gets, you know, your hips and knees moving. It certainly builds strength. And it's definitely an alternative. If for some reason walking doesn't suit, running doesn't suit, you see a lot more people now, kind of as they go into older age, they might have given up the running, but they're moving to cycling. So it is absolutely a great idea, you know, and you don't have to go out on a bike. We know, you know, sometimes Ireland's weather and Ireland's roads are not great, but then you can do cycling in a gym type environment. You can have your stationary bike at home or in a gym. But absolutely, cycling is great. And I cycle and I love it because I do feel it just breaks up. Because I do other activities, but I do like the cycling and actually you can also just get places quicker with cycling.
Yeah, good for the environment as well.
Yeah, and it's a great way to see the country. You can go places and, you know, on your bike and just see places. So yeah, it is. I think it's a really good option for people with knee problems and with hip problems as well. Yeah.
Okay, great, thank you. We have another question here from somebody who has acute tendonitis in their shoulder. And they've had an ultrasound that showed a partial tear and damage to the ACL joint from RA. But their physio advised them not to exacerbate by raising up their arm in an aqua class. So they were just wondering, how would they strengthen that particular area then if they can't raise it up? Is there something they could do maybe?
Yeah, and look, I suppose if they've already going to a physio, the physio can be more specific about the types of strengthening, and yeah, I totally understand kind of what they're saying there in terms of why it's bothering them. We can do strength work down low, and sorry, I'm kind of doing it as I'm talking here, but you can't see me doing it. But usually for people with shoulder problems, I don't know if people can see me, but usually the problem is up here. Right, so people kind of struggle with something like the rotator cuff, which I suspect is what person has a problem with, the rotator cuff tendons. So it's kind of above that, this 90 degrees. So people are struggling up here, but actually we can strengthen below that. So what you can't see here is I'm moving my arm, and down here we can still strengthen those muscles. People can use the elastic bands, they can use the weights, but they're down in this kind of, they're not in an overhead position. People can do the exercises you know, lying down. So again, you're kind of, there's less gravity playing a role there. So there's definitely options, and that might be that specific strengthening. So if that person is going to a physio, it's really to have that conversation about the specific strengthening, maybe just trying to like offload from the overhead for now. And so that doesn't mean kind of permanently. Sometimes as people get better and they get stronger, kind of outside of the overhead position, they can progress up to an overhead position over time.
Okay.
Hopefully that helps.
Yeah, I'm sure that does. There's a question about flexibility exercises during an RA flare. So they just want to know, is it okay for them to continue to do those exercises during a flare? I think you mentioned some of that during the talk, but
yeah,
I don't know how to reinforce it.
Yeah, exactly. Yeah. So look, it's about, maybe it depends on how vigorous you are with your flexibility when you're not in a flare. You know, it doesn't have to be vigorous stretching, but certainly keep your movement, keep your range of movement, keep that flexibility. If it's a very inflamed joint at the time, that's where the icing can help. So pop on ice for 10-15 minutes, you know, just bag of ice, wrap it in a damp towel, leave it on the area for 10-15 minutes, and then do the flexibility, because then you've just calmed it down a little bit. But actually flexibility would definitely be a thing to continue doing. What you might find is you're not going to, maybe when you're trying to get to the end of the movement, you may not just go as vigorously as you would with outside of a flare, but you definitely would keep most of that going.
Okay, great. We have another question here, and I think we have a few of them about fibromyalgia. This one is, I have OA and fibromyalgia, and they're wondering what the best exercise for these conditions is combined. And they also find it very difficult to keep their hands and feet warm, which I presume would sort of almost inhibit you from exercising. If you have trouble keeping yourself warm, it's probably quite difficult then.
Yeah. So look, the fibromyalgia evidence would suggest actually different types of exercise does different things. So again, I'd come back to any type of exercise helps. I think if people had to make a choice, I would always go for the aerobic type of exercise. So that heart and lung fitness exercise. And I suppose if you've a bit of both, it's going to help both. So again, that could be walking, swimming. It could be, I think sometimes for fibromyalgia as well, like things like cognitive behavioral therapy has been shown to work. So that's kind of that kind of mind body type of approach. And this is where things like Tai Chi and yoga can help, because there is that kind of mind body approach with Tai Chi and yoga, so they may help. I mean, the hands and feet warm, I suppose, well, is that part of that condition, or is that something else? I don't know. I mean, I suppose we don't have to, I don't know if that's just going outside. In a way, when we move, our circulation flows. So in fact, as you move, you're actually helping your circulation, and sometimes people are cold by not moving. So again, you might, if you're going into water, you might try and find pools that are a bit more heated than a cold swimming pool. There are more heated pools, again, probably just in your local area. some of the pools are more heated, particularly if they're used for you know, kind of maybe other populations, like we have certain centres that have pools that are for people with medical conditions. So you could try that as well.
Okay, great. There's a question here from somebody who said they're keen to get moving, but it's a long time since they've tried any type of exercise and they're a little bit self-conscious, particularly when it comes to wearing gym gear or going swimming. Have you any advice about where they could start?
Yeah, exactly that. And I really don't want people to think that A, they have to join a gym, and B, they have to go swimming, because it's not for everybody. So, I mean, could it just be walking? Like, honestly, walking is free. I mean, when I say easy, it's there. You just walk out the door and you're walking. So I would say just start walking. And, you know, again, it doesn't have to be miles. You could start off, it depends on how much you could think you could do now. You know, if it's 10 minutes today, 5 minutes, it doesn't matter. It's something. So walking has a huge number of health benefits. People underestimate actually how good walking is.
Yeah.
It's just so easy. So that would be my advice, walking.
Yeah. And you don't need any particular gym gear for it or anything like that.
Exactly
just a
that.
pair of runners.
Yeah, exactly. Maybe a good rain jacket can help.
Yeah, definitely for Ireland anyway. There's somebody here who says they use a gym and they've mentioned to the class instructors that they have arthritis, but they don't seem to understand that I can't lift heavy kettlebells and weights. And should I stop doing these classes and try to use resistance bands instead, perhaps?
Yeah, possibly. Yeah, look, I suppose the health instructors aren't dealing with people with medical conditions every day. So yeah, and arthritis covers so many conditions. So it depends on the type of arthritis you have. Yeah, and look, if you can't lift heavy weights, I would say don't. You know, there are lots and lots of other options. I wonder, are there other classes in the gym they could do? Can you go to the instructors and just say, look, I just want a specific program. They could use bands, they could use lighter handheld weights. There might be stuff to do, as I mentioned in the lecture, with body weight. So yeah, so maybe that class right now isn't for you if there isn't an option to drop the weights. Maybe there's another class, or maybe there could be more bespoke program that one of the instructors could do for you if you explain what you can and can't do.
Yeah, absolutely. And then there's another question here about the actual cause of stiffness, and they're wondering if it's a buildup of fluid in the joints.
Yeah, that's actually, that's a really good question. I suppose in short, probably yes. I mean, there's probably lots of reasons why it's stiff, but I suppose one example is when we know that people with inflammatory arthritis, like rheumatoid arthritis, have more stiffness, particularly in the morning, than someone with osteoarthritis. So we have that kind of 30 minutes. We often use that 30 minutes as an indicator to separate them out. People with osteoarthritis usually would loosen up quicker than 30 minutes. And I suppose they don't have huge amounts of swelling. Whereas somebody with rheumatoid arthritis, ankylosing spondylitis, it's a more inflammatory type of arthritis. And that's one of the reasons why they have that greater duration of stiffness in the morning, for example. So yes, so then if you take that a next step, then when people have a flare and they find they are going through more periods of they've more swelling and they've more pain, it is because of the swelling. They'll feel stiffer. So yes, in short, it is related to the swelling. Maybe not all of it, but a huge amount of it is related to the swelling. Yeah.
Okay. Great, thank you very much for that, Helen. I think we're going to finish our Q&A now because I think we're just kind of conscious of time, but thanks everybody for their questions. We really appreciate them. And I'm just going to close out just a couple of little things. And I will just wanted to say again, thank you very much to our sponsors, AbbVie and Novartis, for supporting us during this National Arthritis Week. And just a reminder also that we do rely on the generosity of the public to ensure that we can continue to provide our essential services and supports. So if you would like to show your support for Arthritis Ireland, you can make a one-off or monthly donation, and you can scan the QR code that is on the screen. Or if you're feeling particularly energetic after listening to Helen, then you can also join our team of fundraisers and sign up for the VHI Women's Mini Marathon this June. It's a great fun day out, and if you want to register, you can do it on our website. So just that leaves it with me just to remind you as well that we've one final webinar this week, which is about arthritis and food, everything you need to know, with registered dietitian Louise Reynolds. And you can register on our website. That's on Thursday at 12:30. And we will also send a recording of this webinar to everybody who registered, and you'll receive that tomorrow. So if you didn't get all of it, or if you want to watch it back again, you'll get an email with the recording tomorrow, and it'll also be available on our YouTube channel. And then it leaves me with just a note to say thank you so much to Professor Helen French. We really appreciate you giving your time today and all of that valuable information. I think it has been really interesting and certainly motivated me now to go out for my lunchtime walk when I still can. And just to remind you also that if you need to contact us, our helpline is open from Monday to Friday from 10 to 4 p.m. and you can call us on 0818 252 846. Or we have lots of information and resources on our website at arthritisireland.ie. So thank you all very much again. We really appreciate your participation and Helen's involvement in the webinar. Thank you.
Thanks very much, everybody.